You are enjoy watching I Love My Body TV, health and beauty tips for all.
Hi friends, how are you? I pray to God for you to be healthy. This is your favorite channel. The channel that gives you useful health and beauty tips. Okay, watch this video. About how to cure cancer. Tips number 1. There are many different types of treatment combinations for cancer, and one may wonder as to how a specific treatment scheme is determined for each cancer patient. Each cancer treatment plan is personally tailored for patients based on many factors relating to the cancerous tumor. The article explains about cancer surgery, chemotherapy, radiation treatments and additional methods. Whenever one hears about cancer treatments, they immediately think of the words chemotherapy and radiation. It is unknown to most how a cancer patient's treatment is specifically determined. Patients do not know when will one receive chemotherapy or radiation treatments, or maybe both, and when one will undergo surgery, or maybe none of the above, as they will be introduced to additional treatment options. Firstly, it should be known that each cancer patient receives a personal tailored treatment plan according to his or her cancerous tumor. When an oncologist approaches a patient in order to start planning his treatment regime, we will look into a few different factors, including the location of the cancer, the stage of the cancer, has it spread to other organs, the size of the growth, and the specific type of the disease. In some cases, the oncologist may also take into consideration the age and general health of the patient, and in women, the doctor can take into consideration future procreation preferences. Once all this is known, the oncologist will design a treatment plan designated for the patient. Surgery is one main option for cancer removal, depending on the tumor, of course. Not every cancer is operable, as it depends on the stage, size and location of the growth. If the cancerous cells are accessible and the tumor is still in its early stages, then the surgeon will prefer to try and remove the whole tumor at once, pending on the fact that the cancer hasn't spread. Sometimes, if the infected organ is not vital to the patient's life, a kidney or the uterus for example, then it is possible the surgeon will want to remove the whole organ that contains the cancer. Sometimes there can be a partial removal of organs with the cancerous cells. A surgery can be accompanied by additional treatments and may not be enough by itself. These additional treatments can include chemotherapy and radiation treatments. Chemotherapy is a type of cancer treatment that uses drugs to try and kill the cancerous cells in the patient's body. The drugs are usually given in cycles that are supposed to maximize its effect, which is to stop or slow down the growth of the cancer cells in the body. The specific type of chemo drugs is decided based on the type of cancer, whether you've gone through chemotherapy before, and other health problems you might have. As stated above, chemotherapy can be the only cancer treatment. However, it will usually be given along with surgery, radiation therapy, or biological therapy. Radiation therapy describes the use of high-energy radiation, X-rays or gamma rays, to shrink tumors and destroy cancerous cells. The radiation destroys the cell's DNA, and cells with damaged DNA stop dividing or die. The rays are delivered by an external machine or from a radioactive device temporarily placed within the patient's body. As with chemotherapy, radiation is often given along with other types of treatments. Beyond these three most common treatments, there are additional types of cancer treatments. Biological therapy, similar to chemotherapy, fights cancer with the use of drugs. However, biotherapy works with the immune system and helps the immune system cells fight cancer, while chemotherapy directly attacks the cancerous cells. Thyroid cancer is treated sometimes with the use of radioactive iodine I-131, which is absorbed into the bloodstream with the intention to begin destroying the gland cells, and there are also hormonal treatments that are supposed to balance hormones that encourage the growth of cancerous cells in the body. As a final countermeasure, cancer patients should always inquire about experimental treatments and try to get into clinical trials designated for cancer patients. Okay friends, like this video, share your friends, tell your comments the comment box. Click on the subscribe button below to see new videos. Also press the bell button. Read description for more information.
Thanks for watching.